not sure if we can actually fit you in that quickly. Depends on whether you've had a cancellation, you see. I can have a look at the appointments book if you want, though. Right, okay. Right, yeah. Okay, then we'll leave it like that. Yes, can I help you?
Yeah, the name of Bradley, 1015.
Yes, Mr. Bradley. Just sign the form, please, at the bottom there. Take a seat, please. I'll call you when Mr. Johnson's ready.
This dental practice is not prepared for the unexpected.
No, okay. Mr. Bradley.
Morning. Right, just one filling today. Upper right 6. Have an amalgam tray.
It's stuffy in here.
Yes, it is, isn't it? So, let's see what we can do for you. Right. Now if you just try and relax while I number tooth. You thought we were going on holiday, eh? Sorry, Mr. Bradley, not you. I was talking to Nicky.
And I don't even know what sort of holiday I want.
Something you might do.
Not a lot, really. And that's the problem. I'm going with my flatmate. I just don't like the same things. I mean, I like just lying in the sun, and she likes dashing around sightseeing.
Why don't we go on group holidays? And we can do what you want, and she can go on trips with somebody else.
No, I don't like that. I don't like
The next 3 minutes will determine whether this man lives or dies. His heart has stopped beating, and he's no longer breathing. But that doesn't mean he's beyond hope. He still has a chance of life, provided the right steps are taken, and soon.
You'll remember to let me know next week, won't you?
Sure.
Let's get some lining here. Right, Mr. Bradley, you'd like to take a rinse? Mr. Bradley? Mr. Bradley? Oh my God. Nicky, Mr. Bradley's collapsed. Get the emergency oxygen. Get the emergency oxygen! And tell Kathy to call an ambulance!
Amazing time. Yeah, Jimmy starts squeezing.
Kathy? Can you get an ambulance? Mr. Bradley's been taken ill.
Sandra, I think I ought to go. One of the patients isn't well or something. Yeah. Okay. Right. Can you put me to Washington, please? It's so hard.
ambulance coming?
They must be really busy. I still can't get through to casualty.
What? I thought you were dialing 999.
You didn't say it was an emergency.
Just dial 999 and get an ambulance, will you, now?
Give us my key!
Yes, in the high street. As quick as you can.
Where's the key? The oxygen key!
Do you mean this? The ambulance will be here in 5 or 10 minutes.
What? Didn't you tell me it was an emergency?
Of course I did, but that's how long it takes!
What's the matter?
It's empty.
To live, we need a regular supply of oxygen to all our organs. In particular, the brain cannot survive for long if it is deprived of oxygen. This man has had no oxygen to his brain for 3 minutes. Even if he were resuscitated now, he would have suffered severe brain damage. Would your team have coped any better? Without training in resuscitation, probably not. The St. John Ambulance Brigade and the Red Cross both provide such training on courses like this one. Resuscitation saves lives. And in a dental practice, it's not just the dental surgeon who needs to know how to do it. In an emergency, a DSA, receptionist, technician, secretary, or hygienist may well have to help, or even take the initiative. If it were you, would you be prepared? We're going to show you the basics of cardiopulmonary or heart and lung resuscitation, but we must emphasize that a video is no substitute for hands-on training. The easiest way to remember the principles of resuscitation is ABC. First, assess the situation. Find out if the casualty is unconscious.
And you can hear me? Can you hear me?
An unconscious casualty will not respond. Make sure the airway is open by tilting the head back and lifting the chin forward. In an unconscious casualty, the tongue may fall to the back of the throat and block the airway. Moving the casualty's head and chin in this way lifts the tongue, clearing the airway. Check the mouth for any obvious obstruction, and if necessary, remove it with a finger sweep.
Get rid of it.
Next, check for breathing by looking for chest movement, listening for breath sounds, and feeling for breath on your cheek. If the airway is clear and the casualty is breathing, turn her onto her side into the recovery position.
So that they can breathe.
Check her breathing and pulse regularly.
Thank you very much for that. Would you like to take the seat again?
If there's no sign of breathing, start mouth-to-mouth resuscitation immediately.
Okay.
Kneeling by the casualty's head, tilt it fully back and open her mouth. Pinch the nose with one hand while the other supports the jaw.
Right way down there now.
Place your mouth making a firm seal and breathe into her. 2 slow, full breaths should be given, each sufficient to cause the chest to rise. The chest should be allowed to fall between inflations. If the chest does not rise with each breath, then either the airway remains obstructed or you have not made a good enough mouth seal.
So we reposition.
Try to clear the airway or improve the seal before continuing.
And then try and get a better.
After these 2 breaths, check the pulse at the carotid artery in the neck. If there is a pulse, continue rescue breathing at a rate of 12 to 15 breaths a minute for an adult, or 15 to 18 for children, and 18 to 20 for infants. When the casualty starts to breathe, she should be turned onto her side into the recovery position, as we've seen.
Turn the head towards us to maintain.
Vomiting often occurs when breathing returns. The recovery position will help to prevent blockage of the airway if vomiting does occur. Mouth-to-nose breathing may be used when the casualty's mouth is injured so that you cannot get a tight seal. As with mouth-to-mouth breathing, open the airway by tilting the head back and lifting the chin, making sure the mouth is closed. Take a deep breath, form a tight seal with your lips around the casualty's nose, and blow. Open the mouth to allow the casualty to breathe out. If there is no pulse, circulation must be kept going by closed chest cardiac compression. Kneel beside the casualty and find the base of her breastbone.
Now, if the pulse is present,
Find the bottom curve of the rib cage and move centrally until you find the central depression. Place the heel of one hand 2 fingers distance upwards from here, over the lower third of the breastbone, in the midline.
one hand
Place the other hand on top of the first and interlock fingers.
the chest. The elbows locked and the shoulders.
With your elbows straight, bring your shoulders up until they're directly over the casualty's chest.
We do that 15 times.
Depress and release the breastbone 4 to 5 centimeters, 1 or 2 inches, making sure your fingers are clear of the chest. The recommended rate is approximately 80 chest compressions per minute. You might find it helpful to count. Remember that a cardiac arrest requires both chest compressions and mouth-to-mouth resuscitation. If you are on your own, give 2 breaths for every 15 compressions. If there are 2 of you, the ratio is 1 breath for every 5 compressions. Now let's see the whole sequence. Remember, A, B, C. Assess whether the casualty is unconscious. Make sure the airway is open. Check for breathing by looking, listening, and feeling. If there is no sign of breathing, start mouth-to-mouth resuscitation immediately. Start with 2 breaths. Check the pulse. If there is no pulse, keep the circulation going by cardiac compression. Remember, 80 chest compressions per minute. Check for pulse and breathing after 1 minute, and again every 3 minutes. Continue resuscitation until help arrives or the casualty recovers. Let's see someone else try. Remember,